Hello Adventist retiree, this is the Medicare Drug Plan Finder Tool video that I told you about in my previous email. This video will hopefully help you pick the correct drug plan for 2018. Some of you may not need to make a change to your drug plan. Others of you may have a change in medications. You may have picked up some new medications. You may not be taking certain medications that you were taking in 2017. All of these different factors could mean that you need to look at some other options for 2018 during the annual election period of October 15th through December 7th. So this is the video that should help you choose the correct drug plan going into 2018. And every subsequent year in the future for that matter. So it's always important every year during the annual election period to revisit the drug plan options for the upcoming year. Not only do your medications change and your needs change, but these drug plans also change every year in either one or many factors. And that's why you received your booklet, Annual Notice of Changes from your various drug plan provider, outlining the changes that happen each year. It's a pain, honestly. I don't envy you for having to go through this. I hate it for you folks, but I don't make the rules, and I'm simply here to help you navigate these confusing topics and make the best decisions going forward each year. So without further ado, just simply follow along this video. Feel free to revisit it at any time. This should hopefully be a relevant video for many years to come, at least as long as Medicare is available to senior citizens in this country. So go to your computer. Obviously you're there now if you're watching this video. So what you're going to want to do is open a web browser. Again, it's probably already open right now if you're watching this video. If you're just starting afresh here with say you just powered on your computer, you're going to want to open a web browser. Some of you may use Mozilla Firefox. Some of you may use Internet Explorer. I personally use Google Chrome, and so that's what we're going to use today. Just simply open up a web browser. It's going to open up to your default window, whether that's your newsfeed page or your email page. I just have mine set to the regular Google search page presently. And we're going to go up here to the URL address bar up at the very top. You can also type in Medicare.gov right here if you'd like in the Google search bar or any search bar for that matter. But for to be most direct and get to Medicare.gov as quickly as possible, just go up to the URL address bar, usually located in the top left or top right of your browser, depending on how your browser is set up. And simply type in Medicare.gov, that's Medicare.gov, and click enter. And that's going to pull up the Medicare.gov website right here. Now again, we'll go back to Google again. If you want to do a web search for Medicare, just simply type in Medicare, and the first listing that pops up at the very top, the first clickable link, should be Medicare.gov, and you can simply click on that link and go right to Medicare.gov as well this way. So this is where we want to start right here. And the tool that we're going to be used is the Find Health and Drug Plans tool right there. I'm going to go ahead and circle this in red. That's where you want to click right there on that Find Health and Drug Plans tool located right there at the top left of the Medicare.gov website. Just click on that, and it's going to bring us here to the Medicare Plan Finder tool. Again, this tool is simply going to help you choose the best plan for 2018. You will still have to call Aon and enroll into the plan that you end up choosing ultimately. So you're still going to have to talk to Aon and tell them which plan you want to enroll into, but this Plan Finder tool will help you choose that plan. Now, if you don't want to deal with this Plan Finder tool, of course you don't have to. You can call Aon directly. In talking with a lot of you clients, some of you had a great representative at Aon that you had to deal with. Others of you had a greenhorn or an incompetent that didn't know really what they were doing, and you got some bad advice. So If you feel confident in your representative at Aon, feel free to call them and help them and have them help you explore your drug plan options for 2018. If you don't feel comfortable doing that and you want to do this your own, if you're more proactive and like to kind of take control of your choices, then this is the best way to do it, and that's by using this Drug Plan Finder tool. Medicare Plan Finder. If you'll notice right here at the top, it's specific for the 2018 plans. Attention, the 2018 plans are now available to review and compare. You can join a plan starting October 15, 2017 through December 7, 2017. That is describing the annual election period, AEP. The dates of October 15 through December 7 are when you can change your drug plans that will go into effect on January 1st of 2018. So we're going to start right here with the general search. You can do a personalized search if you'd like. For this purpose, in looking at drug plans, it's not necessary. The easiest way to navigate this tool is simply right here, start it with the general search of your zip code. I'm just going to put in my zip code here and use myself as an example. Obviously, I'm not getting a drug plan. I'm not Medicare eligible, but I'm going to pretend as if I am for this video and to show you folks what to do here. So, step 1 of 4, right here. It's a simple 4-step process. Step 1 of 4 is enter your information. And just this is very self-explanatory. Just simply read the questions and answer them appropriately. How do you get your Medicare coverage? Each one of you should choose this top option bullet right here. You should choose that bullet right there. Original Medicare, since all of you have original Medicare as your primary. That is your original Medicare as your Medicare coverage. Choose that top one. No need to choose these two boxes below. You can skip that. Again, if you were choosing a Medigap plan or something like that, you would choose those two. But this is just for the drug plan tool. So no need to choose these two here. If you want to choose your current plan, feel free to go ahead and do that. You can choose, I also have a separate Medicare drug plan. You don't have to choose that now necessarily. So I'm just going to leave that unchecked for now. Definitely choose the top one, original Medicare. Second question down, do you get help from Medicare or your state to pay your Medicare prescription drug costs? None of you that I worked with get any help from the state in the form of Medicaid or TennCare or any other state subsidy products. So you're going to choose the I don't get any extra help. Now, if something has changed since I spoke with you last and you are getting help from Medicaid in some form or fashion, feel free to choose the appropriate box here. But the vast majority of you will choose I don't get any extra help. We're going to go ahead and click here to continue plan results. Continue to plan results. Step 2 of 4. This is where you enter your drugs. This is one of the most important screens here and steps in this process. And this is where you are going to add your medications. I'm just going to scroll down here and get in position. Read through everything on every page so you have a good understanding of what you're looking at and what you're doing on each page. It's very self-explanatory. You can walk you through these steps as well. If you don't take any drugs, fine. Just click on I don't take any drugs right there. Or if you don't want to add any drugs now, you can click on that as well and just look at the plans available for 2018. But I would advise you to procure your list of medications, your current list of medications or medications that you think you will be taking in 2018. And this is where you're going to add them to your drug list and create your drug list ID. Now, some of you, if you recall, I gave some of you your drug list ID in various conversations that we had this past year. If you have your drug list ID already that I gave you, and you know your password date, this is where you can enter that information here and skip adding in all of your medications. You can simply enter your drug list ID right there. It's a pretty long number. You'll type that in. And the password date that I gave you when we initially created that drug list ID. And then you can click on Retrieve My Drug List, and it will pull up your drug list specifically. But since we're doing this from scratch, we're going to pretend like you don't have that drug list ID, and we're going to enter some medications in here. Now, obviously, I don't have a prescription drug plan, and thankfully don't have to take any medications on a daily basis. But I'm going to go ahead and put in here some of the most common medications that senior citizens take in this country. just as an example. So we're going to put in a blood pressure medication here, cholesterol medication, a thyroid medication, and some diabetes medications that are common. And I'll also pick pick a brand name drug and an expensive drug as well, just to give you an idea here of how this drug plan finder tool works. Okay, so blood pressure medication, lisinopril, that's a very common medication. If you'll notice here, when you start typing into this search table here, the search bar, a menu drops down. You can just simply start typing the spelling of the medication, and you'll see that the drugs start popping up there according to how you're typing. So we're just going to choose lisinopril. Be mindful there are some combination drugs. This is a lisinopril with a water pill, hydrochlorothiazide combined. Most people don't take that, they just take the regular lisinopril. But if you take the lisinopril/HCTZ, be very specific and choose the correct medication. So we're just going to choose lisinopril for this example. This table pops up and it has make sure you chose the right medication there. Right there at the top it says lisinopril. You're going to choose your dosage. It's going to have a default dosage already chosen, and half the time that is accurate, that's correct. But if you take a different milligram amount, then choose accordingly. And you're just going to choose by clicking on these different bullet points here and choosing the appropriate milligram amount that you take. Quantity. By default, it's going to have a 1 month supply listed here. So 30 pills, 1 month supply. If you happen to take lisinopril twice a day, well, that's going to be 60 pills every 1 month underneath the frequency. So you can change that amount there. We'll just leave it at 30 now. Now, a lot of you, in fact, the majority of you, I believe, are getting your medications via mail order. So if you'll notice right down here at the very bottom, it says pharmacy type. This is where you can change from I get this medication from a retail pharmacy to I get this medication from a mail order pharmacy. So we're just going to click this bottom option here. I get this medicine from a mail order pharmacy. And you'll notice it will change the quantity to 90 every 3 months instead of 30 every month. Because if you're getting it mail order, they're sending you a 90-day supply every 3 months. Every quarter, you're getting that 90-day supply. And just by selecting that mail order option, it'll automatically change those numbers by default. Now, if you go back up here and you realize you've chosen the wrong milligram amount and you change that, be mindful because it will change that figure back to 30 here when you change the options up here. So you still have that at 30, but then it has 30 every 3 months via mail order, so you know that's inaccurate. You want to change that to 90 every 3 months. Again, just look over it, make sure you have everything selected correctly, the dosage, the quantity, the frequency, and how you're getting that medication. Some of you may get the majority of your medications via mail order, and you may get 1 or 2 medications via retail pharmacy. Some of the ointments and creams are actually less expensive via a retail pharmacy, rather than mail order. And so you want to be specific with that. If you take one of those creams, be sure you choose the I get this from a retail pharmacy. Whatever medication you get from a retail pharmacy, choose that option. Whatever medication you get from mail order, choose that option. So again, before you click add drug and dosage, just make sure everything is correct here on this pop-up table and screen. We're going to add drug and dosage, and you'll notice that the page refreshes here, and we've got your lisinopril added there, quantity 90, every 3 months via mail order pharmacy. And it's already a generic medication there. It's listed as generic. If you realize, oh, I've chosen the wrong dose, I want to take 10 milligrams instead of 30, you can click on change dose. It'll pop right back up, change that to 10. Be mindful that it changes the quantity amount, so make sure that reads 90, and then update drug dosage. And again, that changes it to 10 milligram here on your drug list. 90-day quantity, 90 quantity over 3 month supply. And it's still generic there. If you want to remove that drug, you realize you've added the wrong medication, you can simply click remove there, and it removes it from the list completely. So we're going to add it back here again since we took it off. Lisinopril, 10 milligram. We're going to just choose the mail order pharmacy, automatically changes it to 90 every 3 months. Add that back on there. Now, if you'll notice, you've created a drug list ID here. Now, this is something you need to write down immediately. As soon as you add that first medication, it's going to populate that drug list ID. If you don't already have a drug list ID, absolutely copy this, save it on your computer, write it down. Be sure and save your password date, which is going to be the date that you did this, created this first drug list ID. If you want to change that date to a date that you can easily remember, say your birthday, feel free to do so. Just make a change to your birthday, and that way it's something you can easily remember. So I'll just change it to my birthday, January 12th of 76. I'm going to change the password date, and that should update right there. That way, every time I enter my drug list ID, I can just simply enter my birth date. I know that's going to be the password date associated with that drug list ID. However you want to do it, leave it as the date that you initially entered, or change it to your birthday or a day you remember. Just write it down. That's the main thing. You need to write that down. And also remember it's tied to your zip code, so have that written down as well. Okay, so we've got our drug list ID created. We've got one medication added. Let's add another medication here. Let's do another common medication, cholesterol medication. Let's do Crestor, and this will be a good example as well. Start typing in Crestor. You can do that again slower, and you'll see that it automatically populates as I type. And just select Crestor there from the drop down. It pops up. We're going to leave that as a 10 milligram tablet. We get that every 90 days via mail order pharmacy, and that looks good right there. So we're going to add that medication, and you're going to notice here with this specific medication, because Crestor is a brand name, it's going to prompt us and remind you that there is a generic of this brand name Crestor called rosuvastatin calcium. The vast majority of people don't take the brand name Crestor, they take that generic version rosuvastatin calcium. So it's prompting you to use the lower cost generic medication there instead of Crestor. And if you realize that, it is actually a generic, well then leave that one checked. If you do have to take the brand name Crestor, well then by all means or change this option here to Crestor and leave it as the brand name option for this specific medication. You can do that with any medication as well. So if you have to have Crestor or you have to have a specific brand, just change that to the brand name medication there, and we're going to add that. So now we've got two medications listed on our drug list here. Drug list ID is still the same. My password date that I changed to my birthday is still the same. Zip code, still the same. Nothing's changed there. We just have an extra medication added to our list. You can add up to 25 medications in one drug list. Bless your heart if you are taking 25 medications a day. I feel for you. The vast majority of you are very healthy and taking little to no medications, which is fantastic. So I don't think any of you clients that I spoke with are taking anywhere near close to that many medications, which is fantastic. So let's go ahead and add another one here. Common diabetic medication, pill form is metformin. We're going to go ahead and add that metformin HCl. We'll leave that as at the default choice there. Most people that take metformin take it twice a day, morning and evening, or after meal, pre and post meals. So we'll leave that as default. We're going to get that via mail order pharmacy as well. So if you're taking it twice a day, that means that's going to be a 60 quantity every month. When we change that to mail order, that's going to change that to 180 every 3 months by default via mail order, which is exactly what we want. We're going to add that drug to our list here. And now we've got 3 medications there. Let's go ahead and add one more, levothyroxine sodium. That's a very common thyroid medication. It's very inexpensive. Most people take one of those a day. We're going to change that to mail order as well. Automatically changes it to 90. So we've got 4 medications there, 3 generics, and 1 brand name Crestor. Let's go ahead and add an expensive medication here. Some of the insulin, if you're diabetic, some of the insulin pens like Flex Touch or Quick Pen are pretty pretty expensive. So we're going to just choose one here as an example. Let's do a Levemir here. Let's see here. Levemir, there we go. We're going to do the Levemir Flex Touch. That's one of the quick pens that Levemir comes in. And we're just going to use this as an example because it is a fairly expensive medication. 3 milliliter pen, sold in packages of 5. That comes in 1 package per month. If we're getting it mail order, we choose that option here. It automatically changes it to 3 packages every 3 months. That's your 90-day supply. We're going to go ahead and add that in. So we've got 5 medications there. Total drugs in your list, 5 medications. Drug list ID has not changed. Password date has not changed. Zip code has not changed. Make sure you write those down before you proceed. So we're going to go ahead and move to the next step here. We're at step 2 of 4. We're going to move to step 3 of 4 here. Our drug list is complete. We've got our drug list ID written down, and we're going to proceed to the next step here. And that is step 3 of 4, selecting our pharmacies. Okay. Now, again, the vast majority of you are getting your medications via mail order, which is great because 9 times out of 10, that's the most cost-effective way to get your medications. However, you do want to still choose a pharmacy in the event that you need to run out and get a Z-Pack for a cold or an infection. If you need to run and get something really quick and you can't wait on mail order to come in the mail, you want to be able to run out and grab your medications. With any drug plan, remember this and commit this to memory. With any drug plan that you choose, you can go to any pharmacy you want. However, there are certain pharmacies that are preferred pharmacies with specific drug plans. If you'll recall, a lot of you have the Humana Walmart plan. With that Humana Walmart plan, you can go to any pharmacy you want, but you're going to get the best pricing at at Walmart for that specific Humana Walmart plan. And that's because Humana and Walmart have co-branded and partnered together and offered a better savings if you go to Walmart for to get your medications. The AARP Medicare RX Walgreens plan is another one. It's another co-branded drug plan from AARP, United Healthcare, and Walgreens. So again, you can go to any pharmacy you want, but keep in mind some of these plans that you choose do have preferred pharmacies. So we're just going to choose a couple here. We'll choose a mom and pop pharmacy here, and then we're going to choose a big box pharmacy as well. We'll do a Walmart and then just a regular local branded pharmacy here that's close to my zip code. Now, if you go to a pharmacy that's outside of the zip code in which you live, when you initially started this process, you put the zip code in which you live, and that's specific to the drug plan. But if you go to a pharmacy outside of your zip code, you can change that right here. You can search new location or by pharmacy name. So let's just pick a different zip code here. We'll do 37421 instead of 37411, and we'll choose a pharmacy from a different zip code here. So just again, if you go to a CVS that's across town, closer to a place you frequent or work, or if you live outside in a rural area and you go into town to get your medications, you're going to need to put the zip code of the specific pharmacy that you go to here. Now you can only choose 2 pharmacies here as far as your selected pharmacy, so we're just going to remove this Walmart pharmacy and replace it with a different Walmart pharmacy in a different zip code. We'll just choose this one here on Gun Barrel, and we've added that back up here to the top. So we're good. We've got our 2 pharmacies selected. Even though we live in the 37411 zip code, we get our medications from a different pharmacy in a different zip code. Well, we've got one here in our zip code and then one in a different one. So I think you understand what I'm trying to say here. We'll move on. Continue to the plan results. This is step 4 of 4, our last step, and that is to refine our plan results. You can refine your search here. I wouldn't pay any attention to anything here on the far left side. None of you are taking any special need. You don't have any special needs plans. You can click through these different options here and choose different things. But honestly, this is going to just add more confusion to you and not show you all of your options. So but you can use these as filters and refine your results. I wouldn't mess with that at all. What we're mainly looking for here is the summary of your search results. And based on the medications that we put in, you'll see there are a total of 47 plans available in our area. Well, of those 47 plans, we're only going to be looking at 25, and that's because we want to choose this top option here, prescription drug plans with original Medicare. This top option here is the only one that applies to you folks. None of you have a Medicare health plan that's going to be a Medicare Advantage plan, thankfully. I hope the majority of you did not make that mistake and get a Medicare Advantage plan. There are some Medicare Advantage plans that include drug coverage. There are also Medicare Advantage plans that do not have drug coverage. Neither of these options apply to you, so you're only going to click this top option here, prescription drug plans, also called standalone prescription plans with original Medicare as your primary. And of course, your Medigap plan has no bearing on any of this, so don't even worry about that. This is only for your drug plan that we're working here. So we're going to go ahead and click that top option and then continue to plan results. And here we go, your plan results. Again, be sure to read everything on each page. If you'll notice right here at the top, you are now viewing the 2018 plan data, which is great. That's exactly what we want to do, is see the plans available to you next year. If you do want to go back and see old plans in 2017, or do a comparison between your old plan and the new plan, you can click on this as well and see old plans. Your kind of your profile up here, zip code, you've got original Medicare, you don't get any extra help. Here's your drug list ID, write it down if you haven't, write down your password date as well. And again, spend some time here on these pages, click on different things, try different things, get a feel for this drug plan finder tool because it's very handy. And this is something you'll need to be doing each year anyway. So let's go ahead and take a look at our options here. Your current plans, original Medicare. We're just going to minimize this because you know you've got original Medicare. You don't need to change anything there. That continues on each year and renews automatically. The only thing that may change with Medicare is the Part B deductible each year. If you have a Plan G, you are aware that you're paying and responsible for that Part B deductible of $183 this year. It could go up in 2018. It most likely will. It usually goes up every year by a little bit. Hopefully not much. It also can go down. It's gone down in the past. The Part B deductible has gone down, but the trend in this day and age is that healthcare prices are rising, so don't be surprised if that Part B deductible does increase in 2018 to be more expensive than $183 per year. Regardless, the majority of you that have Plan G still have a lot of wiggle room there, in which Plan G is still the better option compared to Plan F. But we won't get into that. We're talking about drug plans here. So we're just going to minimize this since we don't need to look at any of that. What we need to pay attention here are the 25 plans that are located in your specific zip code. Now, again, this is my zip code. Your plans shown will be the ones located in your zip code. We want to choose of the 25 here. Let's go ahead and choose View All and see what that gives us here. All right. I notice when I choose All here, I can't change this sort result. So I'm going to go back here to just View 20 instead. You really only need to look at the first few plans available to you. There's no need to look at all 20 plans. So what we're looking at here, when we're sorting through these plans, the default is set to lowest estimated annual retail drug cost. Okay, we're going to change that to the bottom option here, lowest estimated annual mail order drug cost. Since the vast majority of you are getting your medications via mail order, let's choose that option and resort these plans. It might not make a difference here, but it may. So we'll just see how that changes, and it does. It does change the option there. If you'll notice here, lowest estimated annual retail drug cost, when we chose that option, it had a different plan here at the top. But a few telltale signs here is it does not give any type of figure here as far as cost, and that's a little concerning. This may be a new plan from Aetna, and they don't have the pricing out yet. If you want to visit, come back at a later date and see if that pricing has changed, you can certainly do so. But of the medications we listed, it doesn't give us an estimated annual retail drug cost, so I'd be very leery of choosing that plan without knowing a figure here. Now, if we change that to mail order, which is what you're going to be most likely doing anyway, you'll notice here that the estimated annual drug cost of mail order is listed right there with this drug plan. This is the most important figure for you to focus on, okay? Right here, your mail order annual cost. Each one of these plans that you're looking at, that is the thing you want to be mindful of, that mail order cost. And if you'll notice, the farther you go down, the more that cost increases, okay? So it goes up and up. That's how it's sorted, low to high, based on the estimated annual mail order cost. So here's some things that you want to be mindful of when you're looking at these plans. First and foremost, that's the important figure. Your monthly plan premium, that's how much the premium each month for that plan costs. The deductibles, this plan doesn't have a deductible, thankfully. Your average drug copay and coinsurance cost, those are ballpark figures here. It's going to be different for each medication. So your drug copay is going to range between $1 and $47 depending on the tier. Could be up to 33% to 50% depending on the tier of medication and whether it's in initial coverage, donut hole coverage, or catastrophic coverage. And we'll get into that here shortly. Drug coverage, drug restrictions, and any other programs, all your drugs on formulary. This simply states that yes, all of your drugs are on the formulary, so you don't have to worry about any of your drugs not being covered in this example. Are there drug restrictions? Yes, we'll take a look at those. How you can lower your drug cost, that really is only going to apply to individuals that don't have Medicare. It'll give you some hints here and there, and we'll take a look at that as well. Overall star rating, this is a newer plan, so it doesn't actually have a star rating yet. It says coming soon. And remember, again, you can't enroll into any of these plans until October 15th at the earliest. Now, so let's go ahead and take a look at this drug plan. We're just going to click on it right here and take a closer look. As the screen pops up here, we're going to take a closer look at this specific prescription drug plan. It's the Coventry First Health Part D Value Plus plan. That's the plan identifier right there, that identifying number. It's out of Kentucky. Members, if you already have this plan, that's your customer service number for members. Non-members that want to get more information, that's customer service. Again, if you want to just be double sure about you're choosing the right plan, once you actually narrow it down, you can call these companies directly and get detailed information on the drugs they cover, the costs, etc., straight from the horse's mouth. Get it right from the source by calling one of these customer service numbers here. So monthly drug plan premium, $56. The health plan premium, that would be if it was a Medicare Advantage plan. Since it's not, it's just a standalone drug plan. Annual drug deductible, this particular plan has no deductible, which is great. Estimate of what you will pay for drug plan premiums and drug costs. So remember, that figure that we're looking at, the estimated annual out-of-pocket cost, is for the drug plan premium and the cost of your medications and any deductible that may be associated with said drug plan. And it's also listed here by pharmacy. So if you go to the Walmart pharmacy, you're going to pay $33.39.27. If you go to your mom and pop Brainerd pharmacy here, I'm going to pay $35.41. And the best option, which usually is the case, 9 out of 10 times, the mail order pharmacy is the cheapest option, getting your medication 90-day supply, has an annual out-of-pocket cost of $33.24.42. If you want to break that down to a monthly cost, so it's something easier to digest, just take that $33.24.42, divide it by 12, and that will give you the estimated monthly cost of the drug plan and your specific medications that you take. Now we can expand that one as well. Estimated full cost the plan charges Medicare for your drugs. That'll give you some information there. So this is the difference between these figures here are your savings. So if you did not have this drug plan or a drug plan at all, that's what you would be paying for. That's what I would be paying for my list of medications that we entered in there today. So we'll minimize that. Next thing down, drug costs during coverage levels. So here's your different various coverage levels. Initial coverage level, coverage gap, also called the donut hole, and the catastrophic coverage. And that's what you'll be paying for your medications during these, through these various stages. Okay, and here's your medication right here. All your different medications, the full cost of those medications. Some of them are very expensive, like that Flex Touch pen. Others are very cheap, like the metformin. In fact, some plans will give you some of these tier 1 generics. They'll give you that medication for free. Some of the plans will. Refill frequency, initial coverage, what you're paying for these meds in your initial coverage, and what you'll be paying during the donut hole, and what you'll be paying in catastrophic coverage. Thankfully, this amount right here is below the, you're not even going to hit the coverage gap at this amount. I believe the coverage gap starts right around $39.50 this coming year. In fact, I think it may have gone up a little bit to just over $4,000, if I recall, right around the $4,000 mark for the coverage gap. In other words, you'll pay certain amounts up to that $4,000 limit. After that $4,000 limit, your our initial coverage level, you enter the coverage gap in which you pay a different amount. Once you get through that coverage gap, you'll pay another amount from the catastrophic coverage level going forward. So most of you are not even going to come close to the coverage gap. Some of you do. There are a few of you that are on some expensive medications that blow right through the initial coverage level, through the coverage gap and into the catastrophic level fairly quickly. So that's going to vary from person to person. Estimated monthly drug costs right here for your various pharmacies. I'll kind of tell you what your cost is. You can figure it out that way if you'd like, or just do the simple calculated math here. But that's what you'd be paying essentially every 3 months for these medications via mail order, what you'd be paying if you went to the mom and pop pharmacy, what you'd be paying if you went to the big box larger pharmacies. So drug coverage information. This is important as well. These are your tiers. So we've got 3 tier 1 medications, which are all really cheap. 1 tier 3 medication, which is a preferred brand. 1 tier 4 medication, which is a non-preferred drug. So the Levemir is actually more expensive as a tier 3 than the Crestor tier 4. And that's just because of the specific medications. You can have some tiers that are lower tiers that are actually more expensive than the higher tiers, but it just depends on the med that you're taking. Pharmacy mail order information clearly says mail order is available. There are 6 network pharmacies in the zip code, we chose. So again, just spend your time here with these different pages here. And they're very informative. Take your time clicking around, looking at different things, seeing what's covered, what's not, etc. We're going to go back to our previous page here and look at our drug list once again, or our list of our drug plans, rather. Click on this right here. Sometimes it'll say no if some of your drugs are not covered, but give it a click right there. All your drugs are covered with this specific plan. And again, it shows you the drugs that are in the formulary. They're all covered. None of them require any prior authorizations. There are some quantity limits on the Crestor that we have listed there. But it'll tell you specifically if a drug is not covered. For instance, if a drug's not covered, like vitamin D. Some of you take the big 50,000 IU vitamin D, and it's not covered by any of the drug plans. Some of you take folic acid, and it's not covered by any of the drug plans. So just because it's not covered does not mean it's expensive. Both of those medications are very cheap. But since it's not covered by the drug plan, it will say no here. In fact, let's click on one of the plans here that says No, not all the drugs are covered, and I'll show you here. This is a Silver Script Choice plan, which is a great plan, but it doesn't cover one of the medications in our list, so it's not going to be a good choice for us. The Crestor tab is not covered, which means, and since that's a pretty expensive medication, that's not a plan we want to choose. Now, if it was just like the vitamin D or the folic acid, it doesn't matter if it's covered because the full price of folic acid and vitamin D is very cheap, so it doesn't matter. So just because it says no there doesn't mean it's a bad option. Again, the thing to focus on, whether your drugs are covered or not, the thing to focus on is the estimated annual out-of-pocket cost. This figure right here, right there. That's the thing to focus on. So whether your drugs are covered or not, you're still going to pay that amount that's listed there. So even if you have to pay full price for some of your medications because they're not covered, as long as this number is the lowest number that you're looking at out of all these drug plans, then that's still the plan that you're going to want to get. Don't get hung up on the monthly premium. You'll say, oh, that First Health Part D is $56 per month, when I can go down here and get a, what's that other one that was $17 per month? I can get, let's take a look, see if we can find it again. I can get this Express Scripts plan for $22. It's half the price per month. But let's take a look down here at your estimated annual out-of-pocket cost. Boom. Almost $4,000 more in out-of-pocket expenses because there's probably a lot of your drugs here that are not covered, or they are not covered well. Crestor is not covered, and the price of the medications that you're specifically taking or taking in this situation are not covered near as well. So you could save $25 per month in premium, but you're going to pay exponentially more for your actual medication. So that would be a very silly move to make. Do not get hung up on the monthly premium or the deductible. Focus only on the estimated annual out-of-pocket cost, whether it's the mail order cost or the retail cost. That's the figure you want to focus on right there. It's that first figure on the far left side of your options here. So that being said, once we've narrowed down the drug list the drug plan that we want to enroll in, again, this is just a tool to help you pick that drug plan. You are still going to have to call Aon and actually enroll into the plan through them. Now, some of you may have noticed that last year when we were doing this, or when I was helping you, I would make a recommendation, but Aon didn't offer that plan. So what you will have to do is simply go to the next plan down the list that covers your medications in the lowest cost, at the lowest cost. So if we wanted this plan and Aon doesn't offer it, well, we're just going to drop down to the next plan available, the Cigna HealthSpring RX Secure plan, because it gives us the next lowest out-of-pocket cost for the year for your medications. So you want to choose the plan again that Aon offers at the lowest estimated annual out-of-pocket cost. So you should have 2 or 3 options here to present to Aon and just tell them, in this case, I would call up Aon and say, I want to enroll in the First Health Part D Value Plus plan. I'm pretty sure that's an option. It's a Coventry plan, and I'm pretty sure that's an option through Aon. So they should be able to enroll me into that plan if I wanted to. If they didn't have that plan, the next available option is the one down next on the list, the Cigna HealthSpring RX Secure Extra drug plan, and I would tell them to enroll me into that if they had it. If you happen to strike out twice, the third option down the list, just keep going down the list for that next lowest estimated out-of-pocket cost. If you'll notice here, this plan is still, it's ridiculously expensive per month, but the coverage is still not bad. It's not as good as this guy here, but it's still not bad. So again, don't get hung up on that monthly premium. You're focusing here on the estimated annual drug cost, which is this far left category right here, and that's the figure you want to look at, whether it's mail order or retail. Okay, that pretty much covers it. Again, click through here, click on the different options available to you here. Some of these have some tips here, like lower your drug cost. It'll give you a few things to lower your drug cost, ways to further your drug cost, pharmaceutical assistance programs. Most of those will only apply if you don't have any kind of drug coverage at all, so I'm not sure why they offer this. State pharmaceutical assistance programs, that's only going to apply to people that are in certain income brackets, so that's probably not going to apply to you either. And it's basically showing you the difference here between mail order and non-mail order options here as far as lowering your costs. So kind of a link you don't really need to click on there, but that's pretty much it in a nutshell. I hope this is helpful. I'm just going to show you again how to pull up this drug list again. So say your computer crashes, or you close it down, or you exit out of this site altogether. We'll just go back here to Medicare.gov. And we're going to go through the process again. Find health and drug plans. Put in our zip code, 37411. Find plans, and now we choose Original Medicare. I don't get any extra help. Continue to plan results. And right here, this next step, we don't need to enter in our drugs, our list of medications again, since we already have our drug list ID. We're just going to go right here to retrieve my saved drug list. Enter in that drug list ID there, copy and pasted it. I changed my password date to my birth date. Easy to remember, although it seems harder and harder to remember the older I get. Retrieve my drug list, boom, and it's going to populate that list that we just created. There's our 5 medications that we put in there, and we don't have to re-enter them again. And we can just continue through the process. My drug list is complete. We chose our pharmacies. Our pharmacies are good to go there. Continue to the plan results. Top option here, prescription drug plans with Original Medicare. That's what's going to apply to you. Continue to plan results. And boom, we're right back here to looking at our plan options again. So we're going to sort that by annual mail order drug costs, because that's going to be the cheapest possible option for the vast majority of you. And again, looking at our options here. So I hope this has been helpful. I know this is a confusing topic and many moving parts, and it's frustrating, and I'm sorry you have to deal with this each year, but it is important to be proactive with your drug plans each year during the AEP, annual election period, of October 15th through December 7th. Just to reiterate, AEP has no bearing whatsoever on your Medigap plan. That Medigap plan will renew indefinitely, and it's simply tied to Original Medicare. It's right there in its definition. It's a Medigap plan. It picks up the gap of 20% that Medicare leaves behind, also called a Medicare Supplemental Plan. It simply supplements Original Medicare. If you ever get confused about what your plan does, it's right there in its definition. It supplements Medicare. It picks up the gap Medicare leaves behind. Medigap, Medicare Supplement. So again, AEP has no bearing whatsoever on your Medigap plan, and those will renew automatically each year as long as you pay your premium. But the drug plan is something that changes every year. If you notice, you've got your annual notice of changes from your drug plan provider outlining the changes each year, and that's why it's important to revisit these plans. I don't know why they make changes each year. It's unfortunate. It just creates extra headache and legwork for you seniors, but that's the rules that we have to play in at this point. So again, be proactive with this each year. Of course, I'm always at your disposal. If you don't want to go through this process, if you just get confused, you're having a hard time navigating it, I'm a phone call or email away. Don't hesitate to reach out. And use Aon as well. If you don't want to go through this process on your own and use this drug plan finder tool, call Aon. They have these similar tools there. The problem there is just making sure that you get a competent individual that knows the ins and outs of these plans and how to advise you properly. I would rather take the responsibility and be proactive on my own and look at my options on my own, and then simply tell Aon what plan I wanted to enroll into. That would be my method, but your mileage may vary, and you may want to rely on them to do that. Regardless, you are still going to have to call them and enroll into the drug plan through them of your choice, or you can go on the website portal, your Aon portal, and enroll that way as well. So Call me if you have questions. I'm here to help. And sorry this is so long, and feel like I've been blabbering on here for a bit. So my apologies for being long-winded. I just want to make sure I cover every little aspect of this drug plan finder tool. So use it, Medicare.gov, find health and drug plans button at the top left corner, and just go from there. It's pretty self-explanatory. And you can also call Medicare at any time, 1-800-MEDICARE. If you get stumped in any of this process, dial 1-800-MEDICARE. I mean, that's what they're there for, to help you with these decisions and these options. So, okay, folks, have a good one. If you see my screen here, actually you can. It's pretty late. I won't tell you how late, but it's pretty late. So, I've got a newborn that's been keeping me up at all hours of the night. So. Anyway, thank you to those of you that sent your congratulations. I much appreciated. We're having a ball and getting very little sleep with the newborn in the house. But our lives have changed forever, and we're loving the change. So, thanks so much, folks. I wish you health and happiness as this year winds down. Once again, I'm at your service. Please feel free to pass this video along to anyone that you feel can benefit from it, and pass along, of course, my name and number per my email. If any of your friends, colleagues made the mistake of enrolling into a Medicare Advantage plan last year through Aon and have realized their folly and want to move back to original Medicare with a Medigap plan and a standalone prescription drug plan like you have, then now would be the time to do that. So please pass along my name and number, and we can get them taken care of. If they got their Medigap plan and their drug plan both through Aon, they can still leave Aon for their Medigap and plan needs, and I can absolutely save them money if they are healthy. That is the kicker. You are now past your initial guaranteed issue period in which you can get any plan you want, no questions asked. You're past that period now, so anybody that wants to move their Medigap plan will be beholden to underwriting guidelines and answering health questions, and they can be denied. Now, don't worry, you can't be kicked off your plan if your health fails. Once you have your plan, you're locked into it for as long as you pay your premium. But if these individuals want to switch to another plan, they will be beholden to underwriting guidelines and health questions, and they can be denied during that application process. But send them my way. I'll explain all that to them, and I'm happy to help them out if I can. I'm at your service. Take care, folks. Bye-bye.